I'm going to tell you top 5 mistakes that every physio must avoid while treating frozen shoulder patients. Number 1, don't treat the pain. Majority physios are focusing too much on reducing the pain and giving most of the time for pain reduction, wherein the pain is the result of stiffness of the capsule. That's why frozen shoulder comes under the category of stiff shoulder. So you need to focus more on reducing the stiffness, thereby the pain would come down anyway. You can't reduce the pain without improving the range of motion. Number 2, don't focus on scapular mobility exercise. Already the scapula is hypermobile in frozen shoulder because when the glenohumeral joint is restricted, the next available movement will go to the scapulothoracic joint. That's why most frozen shoulder patients, they elevate the shoulder like that using their scapular mobility rather than glenohumeral mobility. Anyway, the problem is not in the scapulothoracic joint, it's at the glenohumeral joint. The third common mistake is we all tend to give the joint mobilization to the frozen shoulder. Frozen shoulder is not a joint problem, rather it's a capsular stiffness. So whatever superior glide, inferior glide or anterior glide, posterior glide you give, it does not impact the capsule because the capsule in the frozen shoulder is circumferentially stiff. It is stiff in 360 degrees. Your 2 or 3 directions of mobilization will not miraculously open up the capsule and then the patient will get immediate movement. Such miraculous immediate improvement will never happen in frozen shoulder. If that happens, it is not frozen shoulder. If you have to do something sensible, do to the stiff, fibrotic, contractured, inflamed capsule. The fourth mistake is some physios tend to be over aggressive in the treatment, especially during the freezing stage or in the painful stage of the frozen stage. If you are too much moving the shoulder more than the tolerance of the tissue capacity, then the capsule will overreact by giving more pain. Sometimes it can become even more stiffer the next day when they come. So when you give the passive end range movement, you should not be over aggressive. You should do in a way that the patient can tolerate the pain, at the same time get the extra 5-degree mobility during the treatment. How do you measure whether you are aggressive or not? Ask the patient how the pain is same day night or the next day morning how the joint restriction is. So that will reveal whether your treatment is aggressive or not. Last mistake, yet popular amongst the physio, is about strengthening exercise. Strengthening is for the muscles. Frozen shoulder is the pathology of the capsule. By strengthening alone, you cannot get the passive range of motion. Muscle strengthening is useful only to move the joint within the available active range of motion. The strengthening exercise will never improve the passive range of motion in frozen shoulder. In fact, frozen shoulder is a passive range of motion problem. It's not an active range of motion problem. If you spend too much time on only strengthening exercise by giving TheraBand and weight cuff, it can improve the strength within the available range, but strengthening exercise alone will not acquire a new range.